And hello. This presentation today by Dr. Latasha McElwain is an overview of oppositional defiant disorder, ODD. Now, this presentation is for the purpose of an overview on ODD for supervision. So this is just a basic overview of oppositional defiant disorder. In this case, in many other cases, we're typically working with children and we're working with kids. We are moving through the process of dealing with what happens and what we can expect when it comes down to ODD. There are sometimes some different things that do go on that we do also make sure that our individuals that are working in this field understand that could be pretty different, but the basis of most of the symptoms of what goes on with ODD is pretty much the same in most cases. All right, so when we're talking about ODD, we're talking about opposition defiant disorder. We're talking about the difficulties and the challenging times that come up when we're dealing with children and we're dealing with teenagers. Frequently and persistent pattern of anger, irritability, arguing, defiant, or vindictiveness towards you or other authority figures is what we define as oppositional defiant disorder. And when we say towards you, meaning you are the authority figure, you are the adult in the situation. As a parent, a lot of times you don't have to go through it alone. So a lot of times in terms of managing the child's behavior, talking with your doctor, talking with mental health professionals and child development experts can also be helpful. When we're talking about those behaviors that just cause a lot of concern for parents, basically learning about behavior treatments that can help them learn better skills and how to build positive family interactions, as well as being able to manage problematic behaviors. And then we're talking about additional therapy and possible medications that could also be helpful as well. This also may be a need for mental health disorder. So basically, because ODD is considered a mental health disorder, a lot of times our mental health professionals get involved and try to find out the best ways to help families to deal with some of these emotions and these feelings and the anger that comes along with ODD. So moving right along, when we're speaking about the symptoms, sometimes they're very difficult. It's very difficult to recognize the differences between strong will or emotional child versus a child that's being oppositionally defiant. In most cases, I tell individuals it's normal to exhibit oppositional behaviors, but at certain stages in a child's development, some of those behaviors kind of subside for the most part when you think about it. So signs of ODD are generally, in preschool when children are definitely feeling like they don't want to do certain things. And sometimes we can think about it, a child being strong-willed, but helping the child understand, why you're doing certain things. Like I know some parents, I know I'm a parent that used the big boy, a big girl statement, being a big girl, being a big girl, being a big boy, a big girl. And, some of the things that, big people do, that could be a sign of, and if the child complies, that could be a sign of, okay, just strong will or just some emotions the child may be having. But when things get a little bit more drastic, then we start to look at, okay, is it oppositional defiance or not? Sometimes ODD can develop later on in life when a child's in their early teenage years. A lot of times the behaviors cause impairment within the family, social activities, schoolwork, different areas of life that causes concern. When we look at DSM-5, we talk about the criteria. When we think about the criteria, a lot of times we are including emotional and behavior symptoms that last for at least 6 months. And when it comes down to moving forward from there, a lot of times we see a lot of anger, we see a lot of irritability, a lot of irritable moods. Oftentimes we see that the individual can easily lose their temper, and they do it quite often. There's a frequency there. Frequently they're touchy and easily annoyed by anyone or by others. And then sometimes they're often angry and resentful about things. When we start considering some of the things that go on, we also see argumentative type behaviors and defiant behaviors, just always arguing with adults or people in the authority figure, always being basically defiant what's going on and basically refusing to comply with the request, often deliberately annoys and upsets people and blames others for his or her mistakes or misbehavior. So that goes on a lot. There's a level of vindictiveness that comes along with it, which is often being spiteful, being vindictive, definitely showing spiteful or vindictive behaviors at at least twice in the past 6 months. We also look at sometimes if there's severity when it comes down to ODD. There could be mild symptoms, which could be symptoms that occur, in only one setting, maybe at home, or only at school, or only at work, or with peers. The other one could be kind of moderate, where some of the symptoms occur in at least 2 settings, and then it could be severe when it occurs in 3 or more settings. We have some kids that really, flourish in school. However, they're a Tasmanian devil at home, or they flourish at home, but at school they are a hurricane running through. So a lot of things, you can think of, and I use those terms because those are intense terms that can be used when we're talking about someone's behavior and how fast they're moving and things that they're doing, and not thinking before they do something, before they tear up a room or something. So a lot of times when we think about ODD and what I just said, ODD sometimes go hand in hand with our ADHD individuals. So sometimes we see that a person is diagnosed with ODD and ADHD. So a lot of times we do come across the fact that a lot of times our children, some of the symptoms might first show only at home, but then sometimes it will then extend, in other settings, as such as, at school or with friends. So a lot of times we do look at the fact that all children are different, all individuals dealing with ODD have different things that are going on. There are different causes. When we start talking about the causes, there's no clear cause as to why a person is oppositionally defiant about something, or about things that are going on in their life. But some of the contributing causes could be a combination of what's inherited. We can also look at the environmental factors. We look at genetics for the most part, a child's natural disposition, the temperament of a child, possible neurobiological differences in the way the nerves and the brain function. We also look at the environment, which talks about problems with parenting or lack thereof supervision, inconsistency, harsh punishment, the abuse or neglect. Sometimes when it comes down to, an individual not having a parent at all in the home. So sometimes that's a concern as well. When we look at risk factors, we talk about the oppositional defiance is very complex when we're talking about what's going on, the problems that come along with it. We have to consider risk factors as the temper tantrums that individuals have, the temperament of a child, and seeing what's going on, the difficulty to tolerate frustration, and just having trouble just emotionally going through the moments, emotional highs to emotional lows, to trouble tolerating frustration and things of that nature. We're talking about parenting issues. We're talking about a child who experienced abuse and neglect, harsh or inconsistent discipline, or a lack thereof parental supervision. So we're talking about how, our children are kind of not having that parental role model there. Therefore, that is, a risk factor. When we're looking at family issues, children who live in homes where parents, or there's a lot of family discord, parental discord, family discord that's going on, as well as parents that have mental illnesses or substance abuse issues or substance use issues. So those are concerns for our kids living in, some of those environments. Another risk factor is the environment. Being oppositional and defiant behaviors can be strengthened and reinforced through attention from peers and inconsistent discipline from other authority figures such as teachers. So environmentally, it can cause some concerns as well when we're talking about risk factors. Complications? Yes, we're talking about a lot of times our children and our teens with ODD, they have trouble at home with parents and with siblings. They have trouble in school with teachers and peers. They have trouble at work. We talk about adults. They have trouble, our teenagers, they have trouble at work with supervisors and other authority figures. So a lot of times it is a concern. Children with ODD may struggle to make and keep friends and relationships. So ODD may lead to problems such as poor in school, poor work performance, antisocial behavior, impulsive control problems, substance use disorder, and suicide. All right, so moving right along with complications, talking about many children and teens with ODD basically have other mental health disorders, as I mentioned earlier, ADHD disorder, sometimes conduct disorder, sometimes depression, anxiety, sometimes some learning disability or some communication disorders, and then also treating these mental disorders may help improve the ODD as far as making sure the individual is able to get to a better point in their level of treatment with ODD. It can be difficult treating ODD from time to time because, of course, there's a lot of different levels of treatment out there as well. So moving right along, when we're talking about prevention, there are no guarantee for preventing ODD when it comes down to, a child having ODD or not. However, positive parenting and early treatment can help to improve the behavior and prevent situations from getting even worse. A lot of times, early intervention when it comes down to ODD can help to be manage feelings and manage what's going on better, and those the conduct and the behaviors being managed better. Treatment can help restore the child's self-esteem and rebuild positive relationships between you and the child, as well as a child's relationship with other important adults in their life, such as their teachers or their caregivers and individuals that are helping them to live a better life, and that they definitely have to listen to. So this can be a benefit when it comes to early treatment. Diagnosing. When we talk about diagnosing ODD, we have to determine whether the child is oppositional defiant. Basically, a mental health professional like myself is a person that will do a comprehensive psychological assessment. You can also get a psychological assessment from a psychologist. When it comes down to looking at ODD, there are many different areas that we're looking at when it usually ODD often goes along with the behavior and mental health problems. Symptoms of ODD may be difficult to distinguish from those related to other problems. So a lot of times we're looking to give a child a full evaluation, a full assessment. We're looking at the overall health of the child. We're looking for the frequency and intensity of the behavior. We're also looking for the emotions and behavior across multiple settings and relationships. We're looking for the family situation and interactions. We're looking for strategies that have been helpful, and we're looking at ones that have not been helpful to help manage the behavior problems. We're also looking at the presence of other mental illnesses or learning disabilities, as well as communication disorders that might be present with a child, to make sure that we're on the right track. When it comes down to treatment of oppositional defiant disorder, we primarily involve the family-based interventions that come along with us providing services. So we are looking to do types of psychotherapy, and we are looking to train the child in order to be able, as well as the parents, in order to be able to come up with better outcomes when it comes down to ODD. The treatment often lasts several months or longer, and a lot of times the treatment can be it is important that the treatment to treat any co-occurring problems. So it's important to treat those problems, such as learning disability or other things that are going on when we're talking about a child that we're dealing with ODD. Because a lot of times, if some of these other problems or co-occurring concerns are left untreated, then the ODD can become worse, and that could really create some more issues for it. So when we're looking at Medication alone generally isn't used for ODD unless a child has another mental health disorder. So just knowing that, I always tell people there's no magic pill that's going to make your child sit down or make your child say yes, ma'am, or no, ma'am. I make your child not run out the house and leave the home or whatever the case may be. When we're talking about ODD, some of the symptoms, some of the conditions, and some of the things that go on with it. So if a child has a coexisting disorder such as ADHD, anxiety, depression, and then medication management would help to improve some of those symptoms. And then ODD kind of on the back burner is something that will probably kind of smooth out as well, is my experience. We're talking about treatment, definitely talking about parent training. We're talking about parent-child interaction therapy. We're talking about individual and family therapy, being able to work in those areas. A lot of times in parent training, we're looking at parents developing skills that is more consistent, positive, less frustrating, and also be able to participate in the training, have a child participate in the training also. And it is so that everyone in the family will be able to develop goals and be able to share those goals and be able to handle problems in a more appropriate level. And then also involving authority figures such as teachers, and the training could be important also. We're talking about parent-child interaction therapy. We're actually looking at the fact that the therapists will be coaching the parent, dealing with different type of interactions with the child, and helping them to kind of deal with things. And basically, the therapist can, one approach can be the therapist actually just sitting behind the parent in a one-way mirror and using the earbud. So that's something that could be utilized as well. Other things could be parents learning more effective parenting techniques, to work with the child and be able to improve those behaviors and improve those interactions for the most part. When we're talking about individual and family therapy, going through individual and family therapy will help the family to realize that, there are ways that they can manage their emotions, manage their anger, and express their feelings in a more healthier way. The family therapy may improve communications and the relationship amongst the family members and how to work together as a team. Treatment, also cognitive problem solving training. That's also a great one that can work with aiming towards the child identity, and then helping them change the patterns of what's going on that leads to them having behavior problems. So collaborative problem solving, in which the parent and the child work together to come up with solutions that works for both. So everyone will end up on kind of the right track, or on the side where everyone feels like they've been listened to and they've been heard. So basically the cognitive problem solving training basically is a type of therapy that aims towards, again, the child's identity and change through the patterns that lead to the behavior concerns that pop up. So, I like to say that twice because that's something that's real important that I think people probably sometimes confuse with cognitive behavior therapy, which is another part of therapy that we do with individual sessions. Social skills training is another great one. That's another one that's great for helps to benefit the child and help them to understand how they can be more flexible, and also learn how to interact more positively and effective with peers and with other individuals. So social skills is also great. We also look at treatment as part of the parent training. We also look at how to manage your child's behavior by giving clear instructions and following through with appropriate consequences as needed. Also recognizing and praising the child for those good behaviors and positive characteristics to promote desired behaviors. Although some parenting techniques may seem like common sense, learning them in this scenario, this level of treatment is also something that could help with parents being more consistent and facing the oppositional behaviors. And because a lot of times some of what of the oppositional behaviors that are coming up is not really easy to deal with. So sometimes going through some of these trainings and listening and making sure that you understand that, some situations are more stressful than others, will give families a great place to learn and be able to utilize these skills and practice, and practice and be patient with what's going on in the home and with the child. So a lot of time, the most important part about treatment is that there is consistency that's showing unconditional love and acceptance of the child. And even in difficult situations that you realize that you're not going to be too hard on yourself. You're not going to be too hard on your child, of course. And the process can be tough. So it takes a lot of patience from the parents, and takes a lot of patience also, as a child starts to realize what's going on and how this is helping them. So lifestyle and home remedies, talking about home remedies, basically being able to start chipping away at the problem and start figuring out what can be some good strategies to use, recognizing, praising the child for positive behaviors. That's a great one. Modeling the behavior you want your child to have. You want to see out there, demonstrating the appropriate interactions and modeling socially appropriate behaviors is a big thing for children to definitely improve their social skills. Picking your battles, avoiding the power struggle. Just not getting into that and making sure that you're doing well with understanding that everything doesn't have to be all, drag out, knock down, drag out type situation. Setting limits, making sure there are clear and effective instructions, making sure that you're enforcing consistent, reasonable consequences, and discuss the settings, these limits. Discuss setting these limits with the child, and making sure that you are confident and you're able to deal with things, and you're able to focus on communicating well. Moving right along, some other lifestyle and home remedies would be setting up a routine, developing consistent daily structure, knowing what's going on so everybody would be very aware of what's happening, building in time together to develop consistent weekly schedule so that everyone would feel like they're spending time together and doing the things that need to be done as a family. The child would feel heard, seen, and everything else. Working together with parents and other household with some of the household consistencies in the home, the appropriate discipline procedures, with partners, working with your partner and making sure that there are consistent household appropriate discipline procedures happening, and making sure that you are able to also enlist the teachers, coaches, and other adult individuals who spend time with your child. Assign household chores to make sure the child understands that they need to be, or they can be a part of the home, and they have expectations. This right here will also help the child understand that they are expected to rise to the occasion when it comes down to participating in household chores, and giving them clear, easy to follow instructions. Also being prepared for challenges early on. So they're going to be challenges. Your child may not want to cooperate, but for the most part, you will want to make sure that you are helping them understand that they are expected. A lot of times, remaining consistent and definitely facing face to face with the increasing challenging behavior is the key to success, and making sure that this is something that is being addressed in the earlier stages. And then being just very preservant and being consistent. Initially working hard, of course, it'll pay off and develop some of those behaviors better in some of those relationships. Coping with coping and support for the most part. When we're talking about ODD, we know it's very challenging. So when we're talking about it being very challenging, we have to consider the fact that there are a lot of questions to ask, a lot of effective communication need to be tried. In treatment, there's going to be a lot of counseling for yourself and for your family to learn how to cope with a lot of the behaviors and manage the distress of the behaviors that are happening and what's going on with a child with ADHD or a person with an individual with ADHD. Also seeking out more support. Making sure that you're learning how to de-stress, how to have some stress management methods as well, definitely in those difficult times. definitely coping and supporting the strategies that are learned for better outcomes for the child. Of course, when it comes down to the parent, you have to be prepared to deal with a lot of problems, of course, and just getting to a point where you can handle those things. For the most part, when we're talking about ADHD, we got all this information from the websites here. This is some of our references. But the biggest thing is just to make sure that as we are working with individuals with ODD, we realize that there might be some other mental health symptoms that might be going along with what we're seeing, but we want to make sure that we are being consistent and being on the same page when it comes down to working with individuals and trying to work through and cope with a lot of the ODD symptoms. Any questions, again, you can email me or you can give me a call as far as answering questions as to the overview of ODD. And then definitely I can share some of my experience and kind of move forward from there. So this concludes our presentation of ODD.